Herpes, a skin infection highly contagious and affecting billions worldwide. We're not talking about a rare, obscure disease here. We're talking about a common, widespread condition that's caused by the herpes simplex virus, or HSV for short. Herpes is a crafty opponent, spreading through close personal contact. This could be through intimate encounters or something as innocent as a shared lip balm or a kiss. Yes, a simple kiss can give you herpes. It's a silent infiltrator, often going unnoticed until it's firmly established. The reach of herpes is staggering. Over 4 billion people across the globe carry the virus. That's more than half of the world's population. Imagine the entire population of South America, Africa, and Asia combined. That's how widespread this virus is. But here's the kicker. Once you have herpes, it's for life. The virus sets up shop in your body and never leaves. It's like that unwanted houseguest who overstays their welcome, except this one never leaves. Periodically, the virus reactivates, leading to recurrent outbreaks. These outbreaks can be triggered by a variety of factors, such as stress or sunlight exposure. It's a cyclical process, a revolving door of dormancy and activity. As we delve deeper into this topic, we'll explore the types of herpes, the risk factors and triggers. We'll discuss how it's diagnosed and treated, and we'll talk about symptom relief and prevention. We'll also cover the complications of herpes and the emotional impact it can have. But for now, let's paint a picture. What does herpes look like, you ask? Well, it's not pretty. But to fully understand it, we must face it head-on. It's a lifelong condition, periodically reactivating to cause recurrent outbreaks. But what exactly does it look like? There are two faces to herpes, HSV-1 and HSV-2. This statement might sound a bit like a riddle, but it's actually a simple explanation of the two types of herpes simplex virus. HSV-1, also known as oral herpes, is most commonly transmitted through oral-to-oral contact. It's the culprit behind those pesky cold sores or fever blisters that can pop up around your mouth. However, it's not just limited to the mouth area. It can cause sores on your face and even on your eyes. The virus can also be spread to the genitals through oral sex, blurring the lines between the two herpes types. On the other hand, HSV-2, or genital herpes, is primarily sexually transmitted. This strain causes sores around the genitals or rectum, but in some cases, it may also cause oral infections. It's important to note that both types of herpes can be transmitted even when there are no visible sores. So, what are the symptoms of these two types of herpes? Well, they are remarkably similar. Both can cause painful blisters or sores at the site of infection. The sores typically start as small red bumps, then develop into blisters, and eventually become painful open sores. After the sores heal, the virus retreats into the nerve cells where it lies dormant until the next outbreak. Additionally, during the first outbreak, some people may experience flu-like symptoms such as fever, body aches, and swollen lymph nodes. However, not everyone will have noticeable symptoms. Some people may have very mild symptoms that they don't even notice, or they may mistake them for something else like a pimple or ingrown hair. In conclusion, HSV-1 and HSV-2 are two sides of the same coin, both causing a lifelong infection that can produce painful sores. Understanding the difference is key to managing the condition and preventing transmission. So, who's at risk and what triggers these outbreaks? Let's explore that in the next scene. The risk of herpes isn't uniform. Certain factors increase susceptibility. The chance of contracting herpes varies from person to person, and certain behaviors or conditions can significantly up the odds. Firstly, sexual activity is a major risk factor. Herpes is primarily transmitted through direct contact with sores or fluids from a blister. This means the virus can easily spread during sexual contact if one partner is infected. The risk is more significant if you have multiple sexual partners, as this widens the potential pool of people who could be carrying the virus. Another key risk factor is a weakened immune system. This can be due to a variety of causes, from chronic illnesses like diabetes or HIV to temporary conditions like stress or lack of sleep. When your immune system isn't at full strength, it's harder for your body to fight off infections, including herpes. But contracting herpes is just one part of the equation. Once the virus is in your body, certain triggers can cause it to reactivate, leading to recurrent outbreaks of painful blisters and sores. Fatigue is one such trigger. When you're run down and tired, your immune system isn't as effective at keeping the virus in check. This can allow the virus to reactivate, triggering an outbreak. Stress is another common trigger. Whether it's physical stress from illness or injury or emotional stress from work, relationships or life changes, it can have a similar effect on your immune system and increase the likelihood of an outbreak. Lastly, exposure to sunlight can also trigger herpes outbreaks. While it's not entirely clear why this is the case, some researchers believe that ultraviolet light can damage the immune system in the skin, making it easier for the herpes virus to reactivate. So whether you're looking to prevent contracting herpes or manage recurrent outbreaks, it's important to understand these risk factors and triggers. Practice safe sex, take care of your immune system, manage your stress levels, and protect your skin from excessive sunlight. Knowing the risks and triggers is one thing, but how is herpes diagnosed? Herpes isn't a silent invader. It announces its presence through sores and blisters. Now let's delve into how such an invader is detected and managed. Diagnosis of herpes is primarily based on the appearance of these sores or blisters. A healthcare professional may look for these telltale signs during a physical examination. However, herpes can be sneaky. Sometimes the sores may not be visible, or they might mimic other skin conditions. In such cases, lab tests come to the rescue. These tests often involve taking a sample from the sore to detect the presence of the herpes simplex virus. But what happens once the diagnosis is confirmed? The next step is treatment. It's crucial to remember that herpes, as of now, has no cure. Once the virus enters the body, it's there to stay. It might go into hiding only to reappear when triggered. While this may sound disheartening, there's a silver lining. Treatment options are available to manage the frequency and severity of outbreaks. Antiviral drugs are the heroes in this scenario. They can't evict the virus from the body, but they can certainly keep it in check. These drugs are often prescribed to be taken daily or during an outbreak to help reduce the frequency of flare-ups and lessen their severity. In addition to antiviral drugs, there are also several measures that can be taken to manage the symptoms during an outbreak. Over-the-counter medications and home remedies can provide some relief from the discomfort caused by the sores and blisters. But remember, every individual is unique, and so is every case of herpes. What works for one person might not work for another. Hence, it's essential to work closely with healthcare professionals to find a treatment plan that suits you best. Treatment can manage the outbreaks, but what about relieving symptoms and preventing transmission? We'll explore these aspects in the next segment. Stay tuned. While a cure for herpes is elusive, symptom relief and prevention are within reach. Herpes, though a lifelong companion, does not have to be a constant tormentor. There are several ways to manage symptoms and reduce the risk of transmission. Over-the-counter medications and home remedies can provide much-needed relief from the discomfort of outbreaks. These include topical creams and ointments, which can soothe the skin and speed up the healing process. A simple warm bath can also provide comfort and help to clean the infected area. Over-the-counter painkillers such as ibuprofen can ease any associated pain. It's important to keep in mind that these are not cures, but methods to manage the symptoms of an outbreak. Prevention strategies play a crucial role in managing herpes. Practicing safe sex is a fundamental preventive measure. Using condoms can significantly reduce the risk of transmission, but it's important to remember that herpes can be spread even when there are no visible sores. Avoiding contact with sores is another key preventive measure. This includes not only avoiding sexual contact during an outbreak, but also not touching the sores at any time. If contact does occur, washing hands immediately can help prevent the spread of the virus to other parts of the body or to other people. Managing triggers can also help in preventing outbreaks. Common triggers include fatigue, stress, and sunlight exposure. By maintaining a healthy lifestyle, getting adequate rest, managing stress effectively, and protecting oneself from excessive sun exposure, the frequency of outbreaks can be reduced. There's also a role for antiviral medication in prevention. These drugs, when taken daily, can reduce the likelihood of an outbreak and make transmission to a partner less likely. Herpes can complicate matters, though, when it spreads beyond the initial infection site. But by knowing how to manage symptoms and by adopting preventive strategies, the impact of herpes on daily life can be significantly minimized. Herpes isn't content with just one domain, it can venture into other parts of the body. Herpes is quite the adventurous virus, spreading beyond its initial point of infection and potentially causing complications in different parts of the body. This is one of the reasons why it's essential to manage herpes effectively to prevent it from becoming a grand tour of discomfort and potential health issues. One of the key complications to be aware of is the potential for secondary infections. You see, the sores and blisters caused by herpes can become open gateways for other pathogens, allowing them to invade your body. Bacterial infections are common culprits, and these can lead to further complications, compounding the challenges you're already dealing with. Herpes can also pose a significant risk to individuals with weakened immune systems. If you're dealing with an immune disorder or you're receiving treatment like chemotherapy that can affect your immune system, herpes can become a much more serious concern. It's not just about the uncomfortable sores and blisters anymore. The virus can spread to other parts of the body, including the brain, causing a condition known as herpes encephalitis, which can be life-threatening. And it doesn't stop there. Pregnant women with genital herpes are at a higher risk of passing the virus onto their newborns, a condition known as neonatal herpes. It's a serious concern and can lead to severe complications in newborns, including neurological issues and even death. While it's important to be aware of these complications, it's equally important not to panic. Remember, knowledge is power. Understanding these potential complications allows you to take proactive steps in managing your condition, thereby reducing the risk of these complications. But herpes isn't just a physical condition, it has an emotional impact as well. Herpes doesn't just scar the body, it can scar the mind too. It's a statement that rings true for many individuals diagnosed with this lifelong condition. A herpes diagnosis often brings with it a whirlwind of emotions: confusion, fear, shame, and even self-blame. These feelings are not uncommon, and they are completely valid. The emotional impact of herpes is a part of the journey that is often overlooked, but it's an aspect that we can't afford to ignore. The psychological toll can be just as challenging, if not more so, than the physical symptoms. Individuals may grapple with anxiety around future outbreaks, fear of transmission to partners, or feelings of isolation. The stigma surrounding herpes can exacerbate these emotions, creating a sense of alienation and distress. But let's remember that herpes is a common condition, affecting over 4 billion people worldwide. It's not a reflection of one's value or worth. It's simply a skin condition, one that a large portion of the global population lives with. This is where emotional support becomes crucial. It's important for individuals diagnosed with herpes to know they're not alone. Connecting with others who understand the experience can be incredibly healing. Support groups, either in person or online, can offer a safe space to share experiences, fears, and strategies for coping. Professional counseling or therapy can also be beneficial. Mental health professionals can provide tools and strategies to manage anxiety, combat stigma, and foster self-compassion. Encouraging conversations about herpes can also help to break down the walls of stigma, promoting understanding and acceptance. Remember, it's okay to ask for help. It's okay to lean on others. It's okay to feel what you're feeling. And above all, it's okay to prioritize your mental health. Herpes is a complex condition, but with knowledge and support, it can be managed. And that management includes taking care of not just the physical, but the emotional as well. You've got questions, and we've got answers. Let's tackle some common queries about herpes. First off, is herpes contagious? Absolutely. It spreads through close personal contact, including sexual encounters, kissing, or even sharing personal items. Secondly, is there a cure for herpes? Unfortunately, no. But don't lose hope. There are antiviral medications that can significantly reduce the frequency and severity of outbreaks. Thirdly, can herpes lead to complications? Yes, it can lead to infections in other parts of the body. However, with effective management, these complications can be prevented. Finally, how can I protect myself from herpes? The best preventive strategies include practicing safe sex, avoiding contact with sores, and managing stress and fatigue, which are known triggers. Stay informed, stay safe, and remember, you're not alone in this.